Hi class, this is Tawanda again. Just a reminder, my placement is at the Barry Robinson Center, a treatment facility for youth. This week I'm going to speak to you about evidence-based practice. Evidence-based practice consists of three basic principles. The best available research, evidence bearing on whether and why a treatment works. Clinical expertise to rapidly identify each patient's unique health state and diagnosis, their individual risks and benefits of potential interventions, and client preferences and values. Evidence-based behavior practice involves making decisions about how to promote health or provide care by integrating the best available evidence with practitioners' expertise and other resources and with the characteristics, states, needs, values, and preferences of those who will be affected. This is done in a manner that is compatible with the environment and organization context. Evidence is research finding derived from the systematic collection of data through observation and experiment and the formulation of questions and testings of hypotheses. Evidence-based treatment is an approach that tries to specify the way in which professionals should make decisions by identifying such evidence that there may be or for practice and rating it according to how scientifically sound it may be. Its goal is to eliminate unsound or excessively risky practices in favor of those that have better outcomes. Evidence-based practice involves complex and conscientious decision-making, which is based not only on the available evidence but also on patients' characteristics, situations, and preferences. It recognizes that care is individualized and ever-changing and involves uncertainties and probabilities. EBP may be identified as treatment choices based not only on outcomes research but also on practice wisdom and on family values, assumptions of a client and his or her family or subculture. Evidence-based design or development decisions are made after reviewing information from repeating rigorous data gathering instead of relying on rules. Single observation employing this approach. Evidence-based practice has now spread into a diverse range of areas outside of health where the same principles are known by names such as result-focused policy, managing for outcomes, evidence-informed practice, etc. It effectively moves away from the old medical model such as you have a disease, take this pill, to an evidence-presented model using the patient as the starting point in diagnosis. EBPs are being employed in the fields of healthcare, juvenile justice, mental health, social services, among others. Key elements is using the best evidence to guide the practice of any professional include the development of questions using research-based evidence, the level and types of evidence to be developed of questions using research-based evidence, the level of types of evidence to be used, and the assessment of effectiveness after completing the task or effort. Evidence-based practice continues to be a developing body of work for professionals as diverse as social workers. The reason I picked EBP is because at the Barry Robinson, that's the practice approach they implement the most. After a month of assessments and treatment goals, they have what's called a staffings once a month. This is a treatment plan that is reviewed by the client, staff, parent or guardian, and doctor. At this staffing, they evaluate what worked or has not worked in the previous month. If adjustments are needed, such as medication or a different approach to help with the diagnosis, or even the diagnosis may be modified at this time. So my question to you, Do you have a choice to implement evidence-based practice, or is the practice is to only follow protocol? Thank you.